This is the Pennsylvania Clinical Network podcast, where we highlight our network's talent and resources for our physicians and their patients. I'm Dr. John Pagan, chair of the PA Clinical Network and your host. It's my pleasure to welcome back Dr. Arvid Cavale, president of the Pennsylvania Medical Society, to our podcast. In addition to being a fellow physician from my Bucks County, Dr. Cavale is a champion for independent physicians and has made independent practice the center of his presidential initiative. In our first segment, which if you haven't seen, you should, we talked a lot about the challenges facing independent practice and how also independent practice is the solution to many of healthcare's challenges right now. In addition, independent practice carries the soul of our medical profession, and for that reason, both of us are independently and individually passionate about this, but also the organizations that we represent are likewise committed to this cause. Hi, Dr. Cavale. Welcome back. I'm excited to have you back there. I'll get right into it there. We talked about a lot of the challenges that we had before, but one of the solutions is to bring physicians of like minds together. And I know that you have planned a summit for independent physician practices on June 19th. Why did you and the Pennsylvania Medical Society feel that this was the right time to bring physicians together around this topic?
Yeah, thanks for having me, John. And continuing this topic, when I came in and as president, my two sentiments, as a personal mission were gratitude for being a healer and optimism for the future. These are two basic, this is how I have operated my practice. And I figured we should bring that to Pennsylvania Medical Society as well. And what I've also learned over the last decade or so, having conversations with people who are on the other side of healthcare, which is people who are buyers of healthcare, is that physicians are not at the table. And I also learned that how do they decide on, what kind of healthcare services to purchase or what to pay for, what not to pay for? What are high value? What do they think as high value? Do they? And a lot of times I realize that what they consider as low value may not actually be low value, but nobody has educated them from our side to say, hey, like I can only give you examples from my specialty of endocrinology, is to say, yes, an insulin pump, an automated insulin delivery device costs $5,000, but what does it save you? How does it help your employee? For example, if you're an employer, it saves your employee from getting sick, unexpected hypoglycemic events, and ending up in the emergency room. You put two or three things together, and it more than pays for an insulin pump. And what does it allow me to do as a physician? It allows me to take care of the patient instantaneously in real time. I can get data from anywhere in the world that the patient is, as long as he's connected to a Wi-Fi. And so we as physicians have not been at the table where decisions are made to purchase healthcare. And as independent physicians, we are even further dissociated from that reality. So I figured when I laid out my potential plans for my presidential initiatives to the staff, to the leadership of the medical society, it came out as a very broad and deep venture. And so we had to distill down all my ideas. And if you know me from the past, that I like to have, big grand ideas that I like to throw out at people, because if I choose 10 ideas, I know that somebody will pick up one. And so we distilled the whole concept into saying, okay, why don't we create an in-person meeting where we can bring physicians, we can bring purchasers of healthcare. We can bring technology companies. We can bring health plan architects. And this is a term that you will hear more of at the summit, health plan architects, and others who are interested in making healthcare not only accessible but higher value, and at the same time help physicians sort of extricate themselves from this potential hamster wheel that we have gotten ourselves into. So that seemed to be a very reasonable idea for me to say, okay. And then I spoke to a few people that I knew of and asked their interest, and they were ready to jump on within a day. Everybody said, yes, we'll do it. And so it wasn't much of me pulling people through or pulling strings. Everybody just jumped on once we gave people an idea that, okay, this is what we are thinking of. So it was a lot easier than I thought it would be.
Who should be attending this summit? Is there a target audience that you think?
So the title we chose was Independent Practice Summit, and it looks like only physicians and independent practice should attend. That is the core target for initial assessment. But I have said anybody, even if you're not a physician and you're interested in healthcare, interested in bringing sanity to the healthcare system, can attend. Even physicians who are in hospital systems, who want to look at ideas, who want to go back to their hospital systems and say, hey, we haven't really been fair to the healthcare system in a lot of ways. We haven't been playing ball with a reasonable set of ideas, or whoever else. I have people who are technology people who have signed up to come. I have people who design health plans who are not speaking. They've signed up to come. So there are a lot of different people who are interested, because again, I like to look at this in a very optimistic manner, because in 2026 we have so much knowledge, so much technology, so many bridges that we can build, that we should not waste this opportunity. That's how I look at it, because these things don't come along at the same time, sort of converge too many times in our lifetimes. And I think a lot of interest has converged in a very specific manner that I think will sort of spark an evolution. I wouldn't say revolution. I would say an evolution of thought, because I think this is a very crawl before you walk kind of environment.
Is there any particular session or topic coming up in the summit that you're very excited about?
So we have a 2-hour CME session, and we've sort of built it on the basis of the morals and ethics of independent practice. We have 4 speakers, including myself. I will be doing the least amount of speaking, mostly listening and sort of collating the ideas. We have a representative from an medium-sized employer in Scranton. She's a human resources director for I believe a stone company. It's a large stone company, and they have been in the process of avoiding large insurance networks to cover their employees. They are in the process of building relationships and networks with physicians and independent physicians in their neighborhood. And they have had a hard time, and she's going to explain what is the fiduciary duty of an employer who provides health insurance or health benefits to their employees. Why is there a legal responsibility for them to do the right thing by their employees, and why the current system is actually a hazard for their fiduciary responsibility towards their patients. So, and she will come up with some solutions as to why independent physician practices are the only solutions to their fiduciary problem. And then we have a retired ophthalmologist who's flying in from Phoenix, Arizona. He's a good friend of mine, and he's also a serial entrepreneur who has managed and built and sold and multiple ophthalmology clinical networks. So he's going to talk to us about physician entrepreneurship and what's the moral and ethical basis of physicians to be entrepreneurs and build new businesses. And then we have a third gentleman who is from a data analytics company who has done a lot of detailed work on the last few years of where the market is going in terms of healthcare purchasing, healthcare dollars, technology. What does technology tell us, and where technologies can be utilized, and how independent physicians and community organizations, employers, and others can come together to create a unique healthcare ecosystem. So that's sort of where we are. And then I'm going to try to summarize the whole thing. And this is 2 hours of CME for any physician who wants to come. And then there are some non-CME sessions that we have also included. And these are going to be also exciting. One of them is by you. And we would love to see the PACN talk about how they can plug into this ecosystem, and expand its role in terms of having more physicians, extend their geographic footprint, build new types of business models that will make the network more profitable. I really don't shy away from using the word profit, because a lot of our colleagues, use the profit as a sort of 4-letter word. I think profit is good if you profit by doing the right thing and you use your profits towards the right outcomes, right? And that's where I think we should think of profit as, right? So some of the talks are going to be also by companies that are waiting for physicians to create what they call themselves. These are the plan architects, the health plan architects. So they actually design and build health plans for employers from the bottom up, and they don't use conventional insurance networks. They actually build every part of the insurance product, and it's eventually called something called a community-owned health plan, where the health plan will actually reinvest in each community. And this is the exciting part for me. And I don't know about you, but I personally don't expect to see the full fruits of this in my lifetime. But if it happens, it is going to be the independent physician practice that is going to be like the nucleus of a revitalization of a community. That's where I would like to see this happen, because once you have that healthcare's unique footprint, you build ancillary services around it, and then you hire people. There's employment in the community. The taxes are reinvested back in the community. You create a health plan that invests back in the community. You can rebuild into schools and environmental projects and all this other stuff that actually will recreate some of the communities that have been sort of devastated by economic downturns over the last 3 decades or so. And so that's sort of my pie in the sky hope for physician practice.
No, and certainly we're honored to be part of that. And I think, as what the PA Clinical Network gives is physician's choice there, and that was again credit to the Pennsylvania Medical Society who recognized this large shift as a lot of the mega systems were getting bigger and bigger. There's a lot of mergers. There's a lot of acquisitions. It appeared to be that there was only one choice after you finish your training, which was to do that. And the mission of the Pennsylvania Clinical Network is to show that the independent practice also is part of that ecosystem there, and at least providing doctors a lot of the tools that they need to succeed there. And you talk about profit, but really what it comes down to is value. Is that the valuable services that independent physicians can provide. And indeed, there are some things that you'll only find in a tertiary center, and they're necessary when they're necessary. But not everything needs to be in a tertiary center. In fact, a lot of these independent practices are in the hearts of these communities that you talk about reinvesting in, and need to be there for patients, so the patients too have a choice in doing that. And we were never taught population health necessarily, which is what we're talking about. We're talking about taking care of groups of patients, whether it's an employer situation or it's a school district or it's a community. Our physicians are wonderful at taking care of the patients that are right in front of them in the exam room. But it's harder for us, or at least it's not second nature, to look beyond the exam room and say, well, who's not coming in to see me that should see me? Who's in that population that we have to worry about, that is at risk of having a serious health event in doing that? So the concepts of risk, concepts of population health, the PA Clinical Network is teaching, fostering, and doing that, but by no means is that meant to be an endpoint. I think, like you said, dare to dream big. This is teaching us how to take better care of patients and groups of patients, to do it, and how to do it effectively and efficiently in doing that. So we do share the same dream, and I assume that the other participants will also bring their perspectives in that. Nobody has the ultimate answer, but together, along the same journey, we can find a path towards better healthcare, and God willing, it's part of our lifetime and our children's lifetime. But you're right, it needs to begin somewhere, and a lot of it is in the future.
Well, based on the interest so far, we have talked about making this an annual event and building on the initial structures that we put together. So not to get ahead of myself, but I think it's something we always want to think of in terms of like, okay, so we got our first basement built up, but then how do we build a structure over that, right? So foundation is good, interest is good. We don't want that to fade away. We want to continue building on that.
It's great. And again, hopefully the prior podcast, this podcast have built that interest in there. We'll be sure to put a link into our podcast there, but just quickly, if you want to tell people how to register, if you can.
So if you go to the Pennsylvania Medical Society homepage, there is a link that takes you directly to the Independent Practice Summit. It's PA-Med-Soc.org/PA-Med/Arvind-R-176-President/Independent-Practice-Summit. So it's best you could just go to the main website and look up the banner at the bottom, in the center of the website, and it will take you over there, and you will get a registration page. The whole agenda is up on the site. It's a full day event. You get breakfast, lunch, and snacks. If for nothing, you want to just hang out with your friends and colleagues and get a nice meal out of it, that would be great. But I think every participant who comes in with an open mind, I'm pretty sure will get home knowing a few things that he or she didn't know, and also having a path to an optimistic future. That's my simple message to the people who want to attend. Yeah.
Well, thanks so much for all you do and the strong work for independent physicians, the physicians in our PA Clinical Network, and all doctors in general and our profession. We'll be sure to put the link into the podcast. Be sure to look for the first part of our podcast together. We also have another podcast from last month where I was invited onto Dr. Cavale's program that'll give you even more background for it. But again, much appreciation for your time, your initiative, and for daring to dream to make healthcare better in the future.
Thank you.
that about wraps up today's show. Once again, Dr. Cavale, president of the Pennsylvania Medical Society, Dr. John Pagan, chair of the PA Clinical Network, and your host. Thanks for tuning in to this latest installment. Look for our others. And again, thanks for all you do, as well as physicians and all the patients you take care of.